Positive approaches to providing support. Welcome to Module 1, Understanding Behaviour. I'm Amelia Coleshaw and I'm going to take you through this session. This is session 1 of 4 blended learning modules. It's a recording of a presentation with a workbook for you to complete. The workbook will not be marked, it's to aid your learning and for your own notes. During the presentation, you'll be asked to pause the recording and fill out sections of the workbook. You can do this electronically or print it out. Once you have completed the module, you can discuss the workbook with your manager in your next supervision. The modules are Understanding Behaviour, Positive Behaviour Support, Health and Safety, and Policy and Recording. When you've completed them all, you may then also have a live interactive session on Microsoft Teams, and depending on where you work, you may also have a short face-to-face session to learn and practice physical techniques. To get the most out of the session, break it up. Online learning can be tiring. Take breaks when you need to. You can pause the session anytime. Don't be a passive participant. There are activities to complete throughout the course which will promote a deeper level of learning and will be more engaging. Take notes. If it helps you, this will also foster engagement and promote a deeper level of learning. Repeat. If you don't understand something, please watch it again. Ask. If you're unsure about anything, please check with your manager or a colleague, or email me on the internal email system. The aims of the session today are to think about and identify behaviours of concern or challenging behaviours that you come across at work, and to understand the communicative function of the behaviours. And to do that, we'll be looking at antecedents or triggers, setting events, trauma, and functional analysis, which is motivators. The content of these training sessions is taken from a training programme called PROACT SCIPr-UK. PROACT stands for Positive Range of Options to Avoid Crisis and Use Therapy. SCIP is Strategies for Crisis Intervention and Prevention. PROACT SCIP is certified with the Restraint Reduction Network, which means that it meets the current training standards for any training programme that looks at teaching techniques where you may need to physically intervene or restrict people's movement. So we know that the content of the training we're delivering and any physical techniques you may be taught are tried and tested, fit for purpose, ethical, and agreed and approved ways of working. And that's based on the current Department of Health guidance, positive and proactive care, reducing the need for restrictive interventions. Within PROACT SCIP, we use this graphic a lot to describe the types of strategies you probably use in your everyday practice. So we believe that most of the time, 70% at least of what you're doing is proactive, and that is just the general way you work with people and support them to ensure that they're having the best experience of the day they can have, having quality interactions with people, their well-being is good, and they're having a good quality of life. Sometimes, however, as we know, something happens and a person may feel a need to use behaviours, and when we notice that beginning, we then might move into active strategies, which are all the things we might do in order to de-escalate a situation or distract somebody or to switch them to another activity, you know, the things you do that you know work for people. We're usually very successful with our active strategies. However, there may still be occasions where, with the best will in the world, we're unable to prevent something from escalating, and it can become what we might call a crisis situation. And that's where you will have to use reactive strategies, and that may include restrictive interventions. So what is a challenge? It means different things to different people. So I'd like you just to have a think about behaviours you come across in your workplace which you would describe as challenging. Now, there's no right or wrong answers. It's very much just starting to think about some of the situations you're dealing with. And also just think about your current understanding or belief as to why the person does that. And also, how does it make you feel? If you're there where it's going on, if you witness another client or a colleague on the receiving end of a behaviour, how do you feel when you get home that night? How do you feel about coming back the next day? So I'd like you just to pause the recording here, and if you look in your workbooks on page 2, there's a worksheet you can complete. These are some of the things you may have said for the behaviours and the reasons. They're not exhaustive lists, but when we do this training in the classroom, these are typically the main kind of behaviours and reasons that people come up with. So you probably got very similar things, and you might have also written things down that aren't on that list, but that doesn't mean it's wrong. Also, when we're training in the classroom and we talk about how it makes us feel, these are often the words people come up with. And it's perfectly normal and natural to have an emotional response when you're working with challenging behaviours, and it can impact us and affect us, and it's important to be realistic about this and work in a culture where it's understood and there are supports in place to help manage this. We will come back to this in module 3, which is health and safety. But yeah, just to say it is important to be realistic, and if you do notice any of these feelings or they resonate with how you felt, that's absolutely fine, and yeah, quite normal. There are different definitions for challenging behaviour. This one talks about behaviour of such an intensity, frequency or duration as to threaten the quality of life and or the physical safety of the individual or others, and is likely to lead to responses that are restrictive, aversive or result in exclusion. So that definition, you may think of someone who maybe has quite a high level of behaviours that could be dangerous to themselves or others, and it may impact on their lifestyle. It may mean that they can't go out to certain places if it's busy or crowded. It may mean that they need to staff with them at all times that can limit when they can go out and where they can go. It may be that they can't share transport with anybody else. So you may think of people you work with where that applies. This definition from the British Institute of Learning Disabilities just talks about behaviour which is a challenge to us and to the situation or circumstances the person finds themselves in. And that recognises that we all have different levels of tolerance. So it may be that you could find it really difficult to work alongside someone for a couple of hours if they're very repetitive, whereas you may have a colleague who could work alongside them all day and it wouldn't pose a problem. So it is just recognising that what might be a challenge to one person might be different for someone else, and that's okay too. Do you ever feel like this or doing these things? Chances are you can recognise feeling that you want to shout or scream. You might want to push someone out of the way or throw an object. Probably you don't actually go through and act on that, even though you can recognise wanting to or needing to for a brief moment in time. Do you ever feel angry? Most of us do, sometimes. And it's interesting just to take a minute and think about what winds you up and how does it make you feel. So see if you can think back to the last time you felt really pissed off or really angry, and just try to remember what happened, how did you feel, and what did you do to manage it? What are the things that you do that stop you from going ahead and hitting someone or throwing something? You'll have your own coping mechanisms, we all do, and they're different for different people. So what I'd like you to do is pause the recording here and complete the activity on page 3. It's just a list of typical coping mechanisms that often come up in the classroom, and I'd like you just to tick off any that apply to you, and then you've got a box there also to fill in if there's anything additional that isn't on the list. And then think about, if you look back at the ones that you've ticked and any others, think about how easily accessible these are for people you're working with. How easy is it if someone needs to go out for a walk or to go to the gym in the moment, there and then. We know that behaviour serves a necessary purpose for the person. It's not always easy to work with, it can be very difficult, but we do believe that it is often the only option available to the person at that point in time. Some behaviours will have been learned through a history of interactions between the person and their environment, and maybe behaviours they've seen other people doing or what they've been exposed to. And all of us are the same in that when we find something that works, we tend to use it again and again. And often it will communicate something about a person's unmet wants or needs. Behaviour can be influenced by triggers, setting events, trauma and motivators, and that's what we're going to be looking at next. We often look at antecedents or triggers, and if you think about people you know well, you're probably aware of what some of their triggers are. And they can be external or internal, and that's the same for all of us. So it's worth just taking a minute to think about how do some of these things influence your behaviour, and that will be down to the environments you're in and the type of person you are. So if you pause the recording here and look at the exercise on page 4 of your workbooks, and it will give you an example of an internal antecedent being hungry and an external antecedent maybe being in an environment that's too noisy. So complete those, and then when you've done that, you can also add any additional ones that you think might be specific to people with learning disabilities. With external antecedents, we often look at the physical environment. How comfortable is it? How tolerable is it? And what kind of quality is it? So if you're in a comfortable environment that's good quality, and the lighting and the sound and the amount of people in the space and the movement and anything like that is as you need it to be, that's a good experience. However, if it's not those things, then it can be quite challenging and you might be quite limited in what you can actually do about it. The social environment is about other people, our relationships and our interactions. And here it's worth thinking about the other people in your life that you interact with. And obviously at work you have to interact effectively with colleagues and clients and managers, but you also have a lot of interactions in your personal life, generally with people you choose to spend time with and interact with. And if it's not working for you, you might decide not to spend so much time with that person, or that you don't enjoy their company as much. It's worth just bearing in mind here that for people using services, most of their interactions every week are with people who are paid to be there and paid to interact with them, and that makes it quite different to a natural reciprocal relationship that we might enjoy in our personal lives. Other external antecedents, the degree of power, control and choice that we have, and again often that's about what we do, who we do it with, where we do it, when we do it, being able to not do it if we don't want to. If that's compromised, then that can affect behaviour. Effective communication and anything that reinforces a behaviour. These are some of the internal antecedents that probably apply to all of us. Being in pain, hungry, thirsty, anxious, sensory sensitivities, being tired, feeling afraid, or being angry. These are other internal antecedents that might be more particular to people with learning disabilities. Communication, disability specific conditions. You may be working with people who have autism, and obviously that condition, lots of things about that can affect people's behaviour. You may be working with people with a learning disability who now also have or show signs of dementia and some of the problems that can bring with it. The medication people take and its side effects, physical, sensory impairments, memory difficulties, maybe having a short attention span and not being able to solve problems very effectively on your own. Also, emotional disorders. Think about people you know with a learning disability and their level of self-esteem and how confident they are. Often people's self-concept or their self-perception isn't that great, and that can have an effect on how people behave in different situations. You may well also be working with people that have a diagnosed or undiagnosed psychiatric or mental health issue or condition, and all the things that go along with that, and where there's not much tolerance for frustration, or again people being quite limited perhaps in how they can manage particular situations. And maybe just not understanding yourself or others, thinking again when you remembered when you felt angry and how did it make you feel. Often we can recognise when that's happening for us, and we can tell that things are changing physically in our bodies. We have that shot of adrenaline and our breathing might change, and we might notice that we're feeling hot or anything like that. And maybe, you know, not being able to read those indicators or understand what they mean can be difficult. And if you could pause the recording here and look in your workbook, on page 5 there's a case study about Jane. So it just gives a description of her life, or well, a day in the life, and asks you to think about perhaps what are some of the internal antecedents that might affect Jane and some of the external ones. And once you've done that, it also asks you to think about, are there any different strategies that could be used or tried that might make the experience better for her. Now we're just going to look at setting events and trauma. The health warning that goes with trauma is just to say, if anyone watching this session has experienced trauma or is affected by it, going through that section and looking at those slides might be problematic for you or difficult, and if that is the case, then do feel free to skip through that section. Unlike a trigger, which happens maybe directly before a behaviour, sometimes behaviours are caused by setting events, and that's more to do with the person's circumstances. So an example of an environmental setting event could be someone that lives in a poor quality environment. Maybe it's cold, maybe it's not clean, maybe it doesn't have heating, maybe they don't get access to good quality nutrition and food, maybe it's a neglectful environment, maybe it's overcrowded, and if you live in an environment like that, it may well affect your behaviour. A physical setting event could be something like a medical condition or a health condition, being in constant pain, that kind of thing. And a social setting event would be to do with relationships. So that could be to do with the breakdown of a relationship, either maybe with a partner or parent or sibling or child, or experiencing a loss or a bereavement. Trauma. The definition here is the emotional shock that someone experiences following a terrible event that involves an actual or perceived threat to one's physical or mental well-being. Trauma can be caused by a range of experiences or different things. For example, neglect and abuse, being bullied, being bereaved. A medical trauma may be from a serious accident, injury, or a diagnosis where you might need to have surgery and treatment. Natural disasters, so things like you're thinking about people that live in some of the places really badly affected by floods and fires. Being exposed to war or terrorism, and displacement, so maybe living in a service setting hundreds of miles away from your family because there isn't anywhere more local where you can be supported. Some of the symptoms of trauma or post-traumatic stress disorder are these. So people might have flashbacks to the event itself, or it could have been a series of events that happened over a period of time. Very intrusive thoughts and images that you can't switch off or ignore, and a really compulsive need to avoid anything that reminds you of the event. And again, that might be particular places, certain people. People often also have nightmares and will spend an amount of time feeling quite intensely distressed. Other trauma symptoms can include having difficulty controlling your emotions, feeling very distrustful or hostile towards the world, constantly feeling empty or hopeless, or as if you're permanently damaged or worthless, feeling as if you're completely different to other people, and for many there'll be regular suicidal feelings. People who have experienced trauma, it will affect the way that the templates or neural pathways in their brains develop. So if you think of someone who in their childhood maybe experienced a series of traumatic events over time, those neural pathways will have become very well developed and ingrained, and it may be that that's then impacts on how the person sees themselves and what they perceive as normal and what they think should be happening. We know that there is some plasticity in the brain, and the more that we exercise or use certain parts of it, the more ingrained and stronger that becomes. And the reason that's important is because we know and understand more now about the physiological impact of trauma. And because those experiences are processed through the neural pathways, and it does make a pattern, and then it can go on to make a lasting neural pathway, one that it maybe is not possible to be undone. And those neural pathways will impact on people's behaviour patterns. And as we said, the more it's used, the stronger it gets, and the less it's used, the weaker it gets. And this can affect the following processes. So people's ability to recognise or respond to danger, self-regulation and impulse control, so maybe not being able to control your impulses or regulate yourself, problems with your memory and attention span, and the way that you process emotional information, and also planning and learning from experience. Now, if you look at some of those things there, they're quite often things we might associate with people with a learning disability. And what's very difficult often for people you're working with is we don't always know what their past has been, and we don't know what people's previous experiences have been and what they've been exposed to. So it is important that we just bear this in mind when we're working with people. And evidence suggests that between 6 and 10% of the overall population will have experienced some form of abuse as a child, and also that this rises to 33% in the learning disability population. So maybe 1 in 3 of the people you're working with or supporting. So we know that people with learning disability are at a significantly increased risk of being exposed to violence and/or trauma. And there's a 9-minute animation. The link for it is on the back page of your workbook, and it's a really nice piece from the NHS Education for Scotland that will just give an overview of how trauma may have affected people and how that presents. I would recommend it if you've got 9 minutes. The last thing we're going to look at is functional analysis, or motivators. So these are things that reinforce a behaviour and might make someone more likely to continue using it. And we break it down into 5 categories. So sensory stimulation, demand avoidance, so people not wanting to do something you're asking them to do or would like them to do. Social attention, tangible, so maybe someone wants a can of Coke or a biscuit or a bag of crisps. And escape or social avoidance, so maybe not wanting to join a group or be in the same room as anyone else, other people. And how do we know? How could we work out maybe what's reinforcing a behaviour for someone? Well, these are some of the good questions to think about, and this is why our recording is really important. Where does the behaviour happen? When does it happen? Is it related to a transition? For example, maybe staff handover, or when the person arrives somewhere, or when the person's getting ready to leave somewhere. What happens immediately before it starts, if you know there is a trigger? What activities and people are involved? Who else is affected by the behaviour? And how good are we at recording and monitoring this? When we are good with it, it can really give us a lot of clues and help us in making sure we support people in a way that maybe makes it less likely that they'll need to use the behaviour. One of the tools that's used is a motivational assessment, and you've got one of these in your workbook. You've also got one that's completed as an example. So if you think of someone you know that you support that uses behaviours, and complete it based on your best understanding of them. If you're new to the service and you haven't really come across that yet, then it might be worth sitting down with a colleague and asking them to do it with you based on their understanding of someone. But do have a look at the example first, and the instructions are in there as to how you score it. And there's another film clip that's worth looking at. Professor David Allen is very well known in the field of learning disabilities and challenging behaviours. It's always good listening to him or seeing him if you ever get an opportunity. And again, the link is on the back page of your workbook, and it's just 5 minutes. And it's a nice summary, really, of what we've looked at during this session. Okay, you've now completed this module. You can discuss your learning and any questions you have with your line manager in your next supervision. And your colleagues will also be able to help you understand the behaviour of people you're supporting and the best ways to provide quality, safe support. Your next module is Module 2, Positive Behaviour Support.